This show is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. The content on this show is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they have, and they should seek the assistance of their healthcare professionals for any such condition.
This is Rooted in Healing with Dr. Beth Claxton, exploring the science of functional medicine and the power of healing from within. Breathe in, breathe out. And now your host, Dr. Beth Claxton.
Good morning. Welcome to another episode of Rooted in Healing. Today we're going to start with a story called Upstream, Downstream. It's actually a fable for our times. It was many years ago that the villagers in Downstream recall spotting the first body in the river. Some old-timers remember how Spartan were the facilities and the procedures for managing that sort of thing. Sometimes they say it would take hours to pull 10 people from the river, and even then, only a few would survive. Though the number of victims in the river has increased greatly in recent years, the good folks of Downstream have responded admirably to the challenge. Their rescue system is clearly second to none. Most people discovered in the swirling waters are reached within 20 minutes, many in less than 10. Only a small number drown each day before help arrives, a big improvement from the way it used to be. Talk to the people of Downstream and they'll speak with pride about the new hospital by the edge of the waters, the flotilla of rescue boats ready for service at a moment's notice, the comprehensive plans for coordinating all the manpower involved, and the large number of highly trained and dedicated swimmers always ready to risk their lives to save victims from the raging currents. Sure, it costs a lot, but, say the Downstreamers, what else can decent people do except to provide whatever is necessary when human lives are at stake? Oh, a few people in Downstream have raised the question now and again, but most folks show little interest in what's happening upstream. It seems there's so much to do to help those in the river that nobody's got the time to check on how all those bodies are getting there in the first place. That's the way things are sometimes. Does this sound familiar? Is this ringing any bells or any lights coming on? I remember the first time I read this parable, I was quite heartwarmed, actually, like somebody really sees it. And it's been going on for a long time. People used to be healthy, and people are generally unhealthy now. And this is why I wanted my friend Holly Papanek to come on the show today. Holly is an osteopathic doctor, and she'll talk about what an osteopath is. And she went to work in an ICU. She loved the drama. She loved the adrenaline surge. She loved the dopamine hits of saving, yes, another person from death. Maybe like those people saving the bodies in the water. And she started asking, why are all the bodies coming into the river in the first place? So we have a really great conversation today about what she started noticing in medicine from where she was, how there really are a handful of very common and relatively easily preventable, I would not even say relatively, I'd say easily preventable conditions that land people in the ICU, that put them into nursing homes, that put them on the launching pad to their grave. So I'd like for you to think about this. There is a lot of prevention that can be done early in life before things really get off the rails. And if we can pay attention and not brush it off, it's our body talking to us. Our body is asking for help. It starts off with subtle symptoms. It starts off with subtle messages. And then it gets louder and louder. So my wish for you is to take something away from our conversation with Dr. Holly today. And we'll be right back after this commercial break to hear right from Holly, Dr. Holly Papanek.
And now, more Rooted in Healing with Dr. Beth Claxton.
Hi, and welcome back. We have with us today Dr. Holly Papanek. Dr. Papanek has over 25 years of experience practicing in hospitals and post-acute and long-term care settings. Her dedication to her patients has earned her the recognition twice for excellence in patient care by her hospital network. However, what truly sets Dr. Holly apart is her ability to take complex medical concepts and explain them in ways that just make sense to real people facing real challenges. As a graduate of the Ohio University College of Osteopathic Medicine, Dr. Papanek's training emphasized a holistic approach to treatment and disease prevention, an approach that's become central to her work with bioidentical hormones. Her professional journey led to a more focused approach to treating women during their most vulnerable phases of life. And when she discovered how bioidentical hormone replacement therapy could address the metabolic and eventual physical decline that so many women face as they approach life, it became her passion. So welcome, Dr. Holly.
Thank you so much for having me.
Oh, you're welcome. I'm so glad you're here because I think this is going to be a very rich discussion on the state of the health of older people and what we can do about it. So first of all, I'd like to hear about your osteopathic medical training and how that differs from like the traditional medical school training that I went through. And so I went through medical school and got a medical doctor degree, and you went through medical school, and what was your degree?
A doctor of osteopathy.
And what does that mean?
Yeah, that's a great question. I'll be frank with you, Beth. When I applied, I didn't really know. My mentor was my family physician, and as a very young child, he kind of took me under his wing. And even when I was in high school, he would drag me around, and we'd do rounds, and we'd go and we'd deliver babies, and we'd go and spend time in his office. I just had a real affinity for it, and I think he maybe saw it in me as well, too. He was a DO. And so when I was heading off and getting ready for college and pre-med and applying to med schools, he threw a bunch of applications from a bunch of osteopathic schools in front of me and said, here you go, get started. So I didn't really know any different. I'd always been surrounded by his osteopathic ways, and so I really didn't know different. Now, what was fascinating about him was he was a true osteopath. He took care of family practice from birth. He would deliver the babies all the way to the grave, and geriatric care and long-term care and that type of thing too. And not just on a superficial level, but deep, and house calls and osteopathy. He just really honored the profession, which has a lot more to do with mind and body and spirit, and everything's connected and more holistic, and not just a pill for everything, but let's talk that through, or let's get some physical therapy. Let's do some osteopathic manipulative treatment, or we call it OMT, where osteopaths function largely as chiropractors as well, too. We're trained in all that movement, muscle energy, and et cetera. So I had seen it all from the beginning, and I guess I didn't know different. And frankly, I wouldn't have it any other way. I think it was fantastic training. My med school was probably very similar to yours in that, classes all day long in the beginning, but then in the evenings we'd go to OMT lab, and we'd spend 2 to 3 hours every evening, Monday through Friday, learning the those types of maneuvers as well to kind of restore that physical component that then led to healing. So yeah, that's osteopathy.
That's so funny. I think it's funny. When I learned about osteopathy and what it was, I thought, well, why didn't I know about that when I was going to medical school?
Yes.
Yeah.
It's so funny what we're exposed to and then kind of where it leads us, right?
Exactly. So you ended up becoming an internal medicine specialist and really focusing in the ICU, right?
Yeah.
So you weren't making house calls and delivering babies and seeing people
I wasn't.
Yeah.
So it was an interesting turn. So it occurred about the time I was ready to graduate. I absolutely intended to join his practice, and we'd both been setting that up for years or what have you. And it was at a time when hospital networks were kind of coming around and buying up practices. It's weird in medicine. We go through these phases where the hospitals want to own all the practices so then they can get all the referrals, and then it goes the other way, and they don't want any. And so unfortunately, he was going through a bit of a business transition that a hospital was buying him up, and he kind of advised that it's not the greatest climate. And so I wound up in the hospital where I must admit I loved it. I just absolutely loved it as much as I loved kind of the cradle to the grave philosophy and being a part of the community and that continuity. I love that as well. But boy, I did also love the adrenaline and the things that happened in the hospital and the procedures and the critical nature and the multi-organ system. This doesn't sound good, and I hope you know my heart in this, but the sicker the better. Like I loved the multi-system and then navigating that and how it's connected and which medication is best to, navigate all those different systems. So I love that as well. So I did wind up staying inpatient, and at that time we called it, and it's still called hospitalist, which basically means, it's more shift work, which was helpful to me because I was a young mom as well at that time. So you just work out 12-hour shift. And so we'd do 7 on, 7 off, see all my patients, hang there for 12 hours, take care of all duties, what have you. But it did lead to a better work-life balance, at least as my children were younger. So that allowed for a little more flexibility. So that's where I wound up. Yeah.
Yeah. And so as a specialist in internal medicine, what are the most common reasons that people end up in the ICU, women and men? I know that we both do a lot of female hormone replacement, but like women and men.
Sure. Most common hospital diagnosis is sepsis, and sepsis just means an overwhelming infection, typically a bloodstream infection from some cause, with the number one cause being urinary or urogenital. So, and between you and me, as you know, very preventable, especially with hormone therapy.
Right.
So certainly infection is the big one and can be catastrophic, especially if it's caught later. If you can catch it early, before the cascade begins, there's a lot of opportunity to reverse it.
And that
once it kind of sets in.
Yeah, that cascade is the inflammation, right? How
yes,
it starts to build on itself and then becomes a tsunami.
Yes, exactly.
Yeah.
And then it leads to, those inflammatory proteins, which then lead to coagulation proteins, which lead to, cardiovascular related issues and collapse. And then we're in deep trouble. Yes. And it's difficult to turn around. It's not impossible, but depends on how far down the road it is. Mm-hmm. But other hospitalizations, specifically some of our bread and butter in the hospital, are the things you would expect, effects of high blood pressure, diabetes, right? So the heart attacks, the strokes, other infections, the pneumonia, certainly very common, especially this time of year. Falls, fractures, muscle injuries, certainly trauma. Internal medicine doesn't get as much of that. That's going to be more your surgical realms. But just a lot of other systems, right? Neurology, again, the strokes, and unfortunately psychiatric type issues. Anything that comes into the ER and that needs to stay and be managed, that's what we take care of. And many times it's not one thing, as you know, right? It's very infrequent, especially in internal medicine, hospitalist medicine. If you're sick enough to be in the hospital, you're pretty sick. and it's not just one thing, right? Nobody comes in with just a stroke. They have high blood pressure. Typically, they have some cholesterol-related issues. Many of them have have diabetes. So they're complicated, and there are a lot of pieces and parts that led them to how sick they are. And so it's a lot of acute treatment of many chronic problems.
So I'm trying to figure out how to phrase this. What would let's do this. Was there a moment or something that happened that made you start to see these conditions as an umbrella, where you realized, oh, there's something happening, when that dopamine hit started wearing off from all the emergencies and the chronic, the acute things, when the chronic things started, like you started realizing, oh yeah, there's a common thread here. Yeah. Can you talk about that?
I can't think of an aha moment other than to say I did begin to get a bit fatigued by it, because it was a lot of the exact same things day after day. Now, every patient's unique and individual, and I certainly enjoy the individuality of each patient that came in. But everybody has hypertension. It just became the same things over and over. And I did begin, I don't want to say numb, but I did fatigue of it. But there wasn't an aha moment until selfishly, and this is embarrassing, selfishly, I kind of started to struggle myself. Mm-hmm. And when I say that, I mean I was struggling in my work. I was struggling with my sleep. I was struggling with my brain fog. And gosh, how come I can't manage these 10, drips hanging there? Why is this vent? So pull it together, Holly. I was starting to either slow or just struggle. I was having some mood-related issues. So I was sort of in trouble. And I'm also embarrassed to admit I didn't know what it was. Internal medicine is considered primary care. I should have recognized some of these things. But unfortunately, in my medical training, even as holistic as it was, I didn't get any perimenopausal or menopausal training. Even in internal medicine, I had GYN, I had OB rotations. I should have known better or recognized some of the signs, but boy, I sure didn't. And I suffered. And frankly, for a bit of time, I thought, I don't know that I'm going to be able to maintain this high level of stress career. I'm flipping. And I couldn't figure out why. Now, I went to my primary care, and because I had so many symptoms, I had symptoms across all organ systems from head to toe. And of course, I went to my beloved mentor, and I was pretty certain, because, we docs, we think we know it all. So I told him, I'm pretty sure I have, early dementia, I have autoimmune disease, I have, I made the list of all the things I had because of my symptoms. And he said, well, I don't think that's true, but let's send you to GYN. I went to GYN, and, she offered me an antidepressant, which I wasn't depressed, but I was kind of quickly getting there because I was struggling. Serendipitously, I wound up at an E4M conference. That's a crazy story, but I sat down, and I know you've had Dr. Rosensweet on before. I sat down in his audience, and he started speaking, and I thought, oh my gosh, this is me. This is what I'm going through. How did I not recognize this? And then the floodgates just opened. That was the aha, and unfortunately, I didn't recognize it in my patients until selfishly I saw it myself, but this is the cause of all my problems. And just by correcting the hormones, all of those symptoms went away. And then as I dove into this, and over the months and years now, I just more and more recognize how, golly, so much of this that I've been treating for nearly 30 years now could have been prevented. Hormones fix. Now, I can't act like they fix every problem in the world, although I often kind of get crazy and say that, but it fixes a lot. From the basic root cause, when you can really get that metabolic health well, it really prevents a lot of those long-term diseases that result in so much illness and debility, and where I spent most of my careers in the hospital, right? The blood pressure-related issues from lack of estrogen and progesterone, the vessel disruption because of lack of estrogen and progesterone, and the hypertension, which led to the stroke. I mean, it goes on and on. Now, it's not abrupt. It's not, a year or two, but shoot, 5, 10, 20, 30 years down the road, how many of those patients, could we have captured before these processes developed that we could have prevented their disease? So, I'm embarrassed to say it was a selfish aha, but it has at least led to a complete change in my practice and my look at chronic disease and my just passion for catching it and catching it early, 20s, 30s, so that we don't have, the 70-year-olds with the hip fractures and the 80-year-olds with the debilitating strokes. What can I do to prevent those? And there's a lot.
Yeah, there's a lot. Yeah. Even like this simple thing of estriol cream on in the vagina will help with urinary tract infections. And like you said, that was number one reason for admission.
Yes. So much good can be done, and it's not very hard. Are there nuances? Are there tweakings? Are there optimizations? Absolutely. But, it's not extremely difficult, and it just doesn't take much. Again, we're not trying to restore youthful levels. We're trying to just get enough replenishment such that our organs work again. Right. And it doesn't often take a lot. And there's definitely really two phases to this care. Certainly there's the symptom alleviation. And I'd be willing to bet that's how you and I get a lot of our patients, right? They're miserable, whether it be one organ system or 15. Everyone's journey is different. But then the second component of this care, which is I'm so passionate about, is this chronic disease prevention. I mean, it's meaningful to be able to prevent these things and to offer somebody a platform, whether it be hormones in conjunction with lifestyle medicine, of course, so that they can be as active for as long as possible. I mean, I can't say enough about that, and I really stress it with my patients because I want them to be aware that, yeah, your symptoms are better. I'm so grateful as well. However, we need to be mindful that we need to stick the course because we're going to prevent cardiovascular disease. We're going to prevent dementia. We're going to prevent colon and breast cancer. So keep up the good work. So, again.
And what would be...
Hormones are...
Go ahead.
Go ahead.
Oh, I was wondering, I want to reiterate for everyone listening, when is the best time to start hormone therapy if we want to get these preventative effects?
Yeah, that's a great question. I think as soon as you recognize any symptoms, and they can be subtle, and unfortunately I think as providers we dismiss a lot, and even as young women we dismiss a lot, right? We make excuses. Gosh, I'm not sleeping well because the kids are keeping me up, or I have teenagers, or we all kind of go through a similar season, or my parents are starting to age and I XYZ, or I'm starting to notice my periods are a little irregular, but my life is so crazy. I'm working and family. I didn't recognize that I was 5 days off last month, and then this day. There are those subtle signs that can start even late 20s, early 30s, that I think as busy women, as busy moms and wives, we just dismiss. I think that's changing. I think there's certainly more awareness, so I'm grateful for that. But I guess my answer would be early, as soon as you start to notice symptoms. And sometimes, as you and I both know, it's just a little progesterone. The progesterone leaves first, it declines first. And so many times in those younger ages, you just need a little more progesterone for a while, maybe even for a handful of years. Until different symptoms, suggest otherwise.
Yeah, and I've found even that's a prime time to start with lifestyle. So, it's sometimes just cleaning up the diet, improving the sleep. Good point. That will, in turn, regulate the hormones. That's and right. So we don't really need any supplements. So what advice would you have to 20 and 30-year-olds, like women and men, based on what you've seen in the ICU, what advice would you be giving to someone who's 20 and 30 now?
Great question. I think I would recommend they always be an advocate for themselves. They're going to have to educate themselves until medicine sort of catches up in this area. I would ask them to kind of be mindful in choosing a provider that is willing to listen to them, hear their symptoms, not dismiss them, and then begin to dive into those lifestyle issues. Those are the foundations, with hormones being one, as they get a bit older and the hormones start to dive. Those are the foundations that if they're not attended to, they slide, just like you're talking about with clean eating, but also movement and sleep and, all the things that we know in terms of good, healthy habits. If those start to slide, they're cumulative. And you won't notice it in a week or a month or a year, but over the years, they build up. And, it's habits, it's poor choices in eating, it's toxins, it's a lot. And the earlier you can catch that, and just be mindful. We can't do everything right. We can't eliminate ourselves from the air, right? We know our air. We still have to eat food. And even if you try to do all the things right, there's still things that sneak in. But just being mindful and being aware and knowing, I think those are our first steps. And I think that in conjunction, eventually when the hormones start to wane, they can lead to a foundation for really a great deal of disease prevention, which is so important.
And also muscle mass, just maintaining. You had mentioned falls and hip fractures are a big cause of admission. And so if someone has muscle mass, balance, if they have that really harnessed in their 30s and 40s, they're going to be so much better prepared going into their latter years, right?
Absolutely. We know that osteoporosis, it's not real glamorous. You can't see the bones. It's just, who wants to talk about osteoporosis? But it's massive. And when we start to enter menopause, we can lose 1 to 3% of our bone each year in the beginning. And that can be cumulative as well, too. And so then you find these, younger gals, 60s, what have you, maybe they trip and fall and they fracture their wrist, right? And it starts there with just these kind of low-impact fractures because their bones are thin. And again, it's muscle mass because we know without hormones that muscles are more difficult to maintain that mass as well, too. But the bones are thinning out as well, too. And then we start to have these smaller fractures. And then, unfortunately, we can have gals that have the bigger fractures. And then, too, it happens a little later because their testosterone supports them a bit longer. But those hip fractures or spinal fractures, they're devastating. 1 out of 5 women don't survive the first year after a hip fracture. That's terrible. And, we talk about, getting rehab and things like that. And for the other 4, that's great. But these are catastrophic and not to mention exceedingly painful and result in rehabilitation. So if we could prevent those, and again, I realize that we're all eventually going to pass. I'm not that Pollyanna.
Exactly.
But if I could choose my hip fracture at 95 versus 65, I'd choose that. I want to be active for as long as I possibly can. I want to be chasing kids and hiking, and I intend to do it for as long as I can. So if hormones support that, and we know they do, that's what I'm going to be shooting for sure, for myself and my patients.
Right, and a low-inflammatory lifestyle.
Yeah, that's right.
Yep.
That's right.
So
it all adds up.
Yeah, good sleep, low-inflammatory diet, and minimizing the toxins, eliminating everything we can. Yeah. Let's see. What other things you want to throw in there?
Let's talk real quick a little urogenital, just because between the cardiovascular and the urogenital part, the amount of benefit, like you had mentioned the estriol cream, or it just doesn't take much to restore a bit of hormone replenishment, so that your organs work. We can talk real quick cardiovascular just because it's one of the, certainly the leading cause of death. But if we're going to go hospital admissions, urogenital and UTIs, there's so much prevention that can be done. Without hormones, that tissue begins to atrophy or kind of break down and just kind of shrivel, if you will, which leads to so many increased infections. And I'm sure you saw a great deal of it too within your OBGYN career too, in the older women with the interstitial cystitis and the prolapse and the pelvic floor related issues, not to mention intercourse and things of that nature, which almost becomes prohibitive due to pain and just overall difficulties and breakdown in those tissues. But
right.
Even just with the estriol creams that can be so restorative, or again, the topicals, are so much good can be done. So and at any age.
And let's also emphasize that estriol is not estradiol. It's what estradiol is turned into as it's leaving the body. So when we talk about estrogen-sensitive breast cancers, that is not estriol, that's estradiol. Yeah. So estriol is already metabolized, it's leaving the body, and it binds to the beta receptors, which are in the skin and the vagina, and really does some really strong work there. And
it's absolutely
often women, I see women that are given estradiol cream by their providers, and it might not have the same impact because it needs to be converted into estriol in order to work, and sometimes that's not happening as much as we'd like. So, no need to be afraid of estriol topical.
Yes,
to help with UTIs.
Not at all. It's wonderful. It still surprises me how estriol gets very little attention, and it's such a wonderful hormone. And it's largely in the most volume, right, in terms of our overall makeup. It's typically, when Dr. Jonathan Wright looked at it, it's 80% of all of our estrogens swimming around, at least that we know of right now. And he also spoke about how its weakness is its strength. Yes, it's a lesser potency, but it's in large volumes everywhere. So to think that we just don't need any is a little remiss. I know a lot of folks just do replace the estradiol because of that potency, and you would get a lot of bang for your buck. But you're exactly right. That estriol has great benefits, especially in specific areas. So, no, you're spot on there.
Yeah.
The other issue is probably the cardiovascular one. And you had spoken about when to start hormones. We know with the cardiovascular-related issue, the earlier you can start hormones, if you're in that perimenopausal period, the more protective you are being, or proactive in protecting your vessels. And let's be honest, vessels are not just heart. Vessels supply every organ of your body, your brain, your eyes, your kidneys, your liver, all of it, your genital, the whole bit. So if we don't have good vessels, again, progression to chronic disease. So if you can start the hormones earlier, whether it be progesterone initially and then adding estrogen as it is needed, and testosterone as well too, we can really prevent vessel disease, which is huge. Whether it be cardiovascular, vascular, or the other organ systems that are fed by the vessels, which is everything. So a lot of good can be done. Number one killer, so certainly has high priority. There can be some difficulties in starting hormones later in terms of getting the same amount of protection. Do I start women later in life? Absolutely. I met with a patient last week. She's 85. She wanted some help with her bones. She has poor osteoporosis. But am I going to gain as much cardiac or vessel protection in her? No, sadly, not as much. Now, there's still decreased mortality rates. So we still are increasing her longevity with being on hormones, but we didn't start it quite soon enough to maybe prevent a lot of that hardening that occurs. But we do still know that there's estrogen receptors in the lining of all those vessels that may help with nitric oxide and some vasodilatation, or kind of the relaxing of the vessels. So we know there's still good that can be done, which equates out to that mortality rate or death rate that's lower. But it's not as robust as if you can catch somebody in the perimenopause or early menopause and really just soften those vessels and maintain them. That's where the benefit is really gained. With some of the data showing 48 to 50% decrease in cardiovascular disease. That's massive. That's massive.
It is. Like, you'd be out of a job, potentially.
That would be so great. Yeah,
Wouldn't that be great?
I would welcome that.
Yeah. So at 85, what do you anticipate how do you see her improving on hormones? I'm thinking maybe with the testosterone, muscle mass, and the ability to be more active. What else?
Yeah. So I did put her on a little bit of estrogen, progesterone, and testosterone. Absolutely. She, despite clearly having gone through menopause years ago, she oddly still has some symptoms, whether it be just some cognition-related issues that I think we may help clear up. A little bit of kind of low mood and depression. I think some of the hormones will replenish that as well. Again, I don't know that I'm going to make great headway through the vascular tree and cardiovascular, but we may, and we know we may decrease her morbidity and mortality associated with it. But her reason and rationale for coming to me was her osteoporosis. She's already had one fracture. She doesn't want another one. Now, we have a lot of ground to make up, but we are moving. She is doing workouts. She does strength training. So we're doing all the other pillars and cornerstones for osteoporosis, supplements and things of that nature to support the bone and the nutrients and such required. But hormones are a cornerstone. And so that's where a lot of our focus is going to be. And obviously, like you said, too, the lifestyle things, quieting down any inflammatory markers that we may find in her blood work, and what does that look like? So kind of just looking at the whole picture. But it's kind of interesting when folks come to you, what is their highest priority? And hers, for me, was osteoporosis. So we'll attack that while obviously working on other things at the same time.
Right. So let's talk about diabetes a little bit. What role do hormones play in insulin sensitivity and diabetes?
Sure. Probably one of the worst risk factors, right? Because it causes such terrible metabolic chaos. And then that in menopause, they kind of increase one another, unfortunately. And we know that women in menopause have a far higher increase in diabetes. It's just this whole metabolic cascade that's trouble.
Yeah, talk about that a little bit more. Like, what is metabolic chaos? What is that?
Yeah.
Pick that
apart. That's kind of what I call it. That's probably not very medically sound, but I see it a lot. I suspect you do as well, too, in terms of the kind of this perimenopause trending towards menopause. So your estrogen, progesterone are down. Testosterone's probably trending down that way, at least heading that direction. Women start to notice, the symptoms and such ongoing. There seems to be some different weight-related issues that seem to set things off. There's a moodiness that is hormone-based, but there's also a lot of inflammation and such going on. There's weight gain. There's difficulties with the changing from subcutaneous fat, which is kind of all over where we kind of live as young women, to moving more towards that belly fat or that visceral inflammatory fat. It leads to this kind of inflammatory, again, I call it kind of a metabolic chaos. Typically, the insulin is all out of whack. We have resistance. The hormones are out of whack. Sometimes thyroid gets in the mix, too. It's just a bit of a mess on many fronts. Mm-hmm. And this is where, talk about lifestyle, you just have to get started, right? And it has everything to do with your intake. It has to do with your sleep. We'll go back to those pillars again. But hormones are a cornerstone, and I find that without getting some of those hormones right, some of that metabolic chaos is very difficult to manage. You probably see the same thing.
Mm-hmm. I do.
Yeah. But diabetes is disastrous. We know it affects all the organ systems, from the eyes to the blood vessels to the kidneys, and unfortunately, it can be reversed. So as I'm certain you see with some of your patients as well, too, with excellent lifestyle management and therapies, diet, exercise, moving, the whole bit, hormone replacement being a key for many times. It can be reversed, but boy, once it gets set in and it's been there 20 to 30 years and has wreaked its havoc, it can be disabling.
Yeah, let's talk a little bit about hormone levels and inflammation and infections.
Sure. So infections certainly occur and take place when things are not well, right? Whether it be the immune system or what have you. And we know that our hormones play a huge role in our immune system, too. We didn't even speak of that much, did we?
Yeah.
But, yeah, so we certainly are more susceptible to any infections when we are not metabolically well. And we know hormones are a cornerstone for that. So certainly more susceptible in those areas, and as are then diabetics. You know, it kind of is this cascade. You know, once one thing falls, then you're more susceptible to the next and the next. And again, just another reason to kind of catch it early before all these stones begin to fall, and just catch them along the way with lifestyle, you know, with hormone replenishment, and again, the pillars that kind of match all those to get those propped up to, again, avoid that chronic disease. You know, we all want to live long. I understand that, but I want to live well. You know, I don't want to spend my last several years in one of my post-acute beds where I see patients, right? I don't want that hip fracture, like I said, at 65. I want to be active until the very end. And if it's lifestyle, if it's hormone replenishment, if it's whatever that may be, that's what I want to do. I want to be able to not exactly live forever, but I want to live well for as long as I can. And I hear people refer to that as health span versus overall lifespan. I like that very much.
Yeah.
To be as healthy as possible for as long as possible. And, you know, these cornerstones, hormones, prevention of infections, all those things, that's my goal.
Yeah, and the phrase, live long, die fast.
Yeah, no joke. Yes, certainly.
It's a way to do it.
Certainly.
So
I know.
let's bring it home about hormone replenishment. Let's talk about it as a longevity type of medicine rather than just symptom management.
Yeah, sure. And again, like that is a huge portion of my practice and my passion about this. I think just with the perspective I have for caring for patients so critically ill, largely I would guess in the last 5 to 10 years of their life, inpatient, and kind of mitigating those chronic diseases as a result of, you know, I'm not going to say all chronic diseases associated with low hormones, but a lot of them are. So if we can start hormones early, if we can prevent that advancing vascular disease like that we spoke about, if we can not allow the urogenital tract, and that's bladder, it's urethra, it's vagina, to not become deficient in its hormones such that it can maintain a healthy linings and function, a good muscle tone. If we can maintain good blood flow support to our brain such that our brain is bringing those hormones to all the neurologic cells so that we aren't losing our cognition, so that we can think, if we can continue our hormones and replenish in such that we prevent infections with the immune support that hormones give, muscle mass, bones, I mean, we could go on and on and on, eyes. Dr. Jeffrey Dash even said that, I didn't know this, that macular degeneration is a hormone deficiency disease. I mean, it's just everywhere. I mean, every cell has hormone receptors on it, and to think that they just aren't needed anymore or shouldn't receive just a degree of replenishment so that they can function is just silly. So, again, just starting early, getting a nice balance, working with a provider that will walk with you and alongside of you, you know, in the early times as well as later, and adjusting those doses as needed to keep you protected, working lifestyle management. I really do think it's the key to not just longevity, but, you know, that overall health span, staying as well as possible for as long as possible. And I just think hormones are a cornerstone across multiple organ systems.
So should women expect to be on hormone replenishment indefinitely, or is there a plan to wean off at some point?
Yeah. You're going to have to scrape them out of my really cold, dead hand because I didn't use them forever.
Yeah.
But, you know, that is an individual decision, but we do need to recognize that, once the hormones are taken away, we start to head that trajectory back down towards, the aggressive aging, right? The vessels don't have the hormones to remain pliable and be able to dilate and accommodate different stressful situations. They become hardened. The brain isn't getting the hormones it needs to remain pliable, and the hippocampal volume that Dr. Bergson speaks about all the time that helps with our cognition, our emotion, and our identity and who we are. And your genital tract starts to go, and the muscle mass. So it all picks right back up again. I don't find that desirable. I think we're heading right back towards that cascade that we've spoken about that leads folks back to my ER. Mm-hmm. Now, again, we've bought ourselves some time. So if you took your hormones up until 80, maybe we postponed that. But those cascades without the hormones, we'll start to see kind of crop up and raise their little ugly heads again. And so I think it's a lifetime. Sometimes the doses may change, different situations and such perhaps, but that's why you need a good provider that can walk through it with you over the many years. But I think it's a life medication, just like you wouldn't tell somebody to wean off their thyroid medication, right? If your thyroid is not producing, which is a whole other story, but you wouldn't say, well, let's wean that off, right? So, there's a lot of dogma around this therapy, but the fact is, all of our organs need it, and I think we should support that. And the literature, the data, the observational trials, and even just your and I's work, we see that. We see that across all ages.
Yeah.
It's beneficial.
What do you hope to see? We're almost at time, but I'm going to try to squeeze this in. What do you hope to see in the next 5 to 10 years for women's hormone health?
Oh, I'm excited about the trajectory that we're seeing. There's a lot of awareness. There are a lot of women speaking out. I love the grassroots movement that they're doing. They're tired of being dismissed. They're tired of being sick and tired. They're tired of their docs not knowing, which, listen, I was in that boat. I've been on both sides of this. I certainly understand. I love that our government has even taken notice of this. The removal of the black box warning, which was completely inappropriate. So there's a grassroots movement that I'm very excited about, and I think women are going to demand change, and they should. They really should. My hope would be that we would also recognize that this is a preventative wellness care, and that insurance might need to step up and take care of some of this for us because they can be costly. So I would love for insurance to see the role in this in attempts to avoid other medications and such too. So that's kind of a dream of mine. And just for the overall better metabolic health, with hormones being one of the cornerstones for just wellness in general, I would love for the hospital to not be full of cardiovascular disease and strokes and diabetic limbs and kidneys. I would love for our country to be more metabolically well. And I think one of the cornerstones, I know it is hormone replenishment. It doesn't stand alone, but it is one of the cornerstones. And I really think that there's awareness, there's talk, and I think we have the attention, of some of those higher up that might be willing to maybe even put a little money behind this to make us healthier longer.
Yeah. Thank you, Holly. Thank you so much for being on.
Well, yeah, thank you so much for your time, and I love your show, and thanks for having me. What an honor.
Oh, you're welcome. And we'll be right back after this commercial break.
And now, more Rooted in Healing with Dr. Beth Claxton.
Thank you for coming back to Rooted in Healing and following us all the way to the end. I hope you enjoyed that conversation with Dr. Holly Papanek as much as I did. It's so elucidating to hear that urinary tract infections, such a simple thing to treat, is number one cause of admissions. So urinary tract infections left undiagnosed turn into sepsis. And that takes many people down really, really hard. So Holly and I met through our group with Dr. David Rosensweet, learning hormone replacement or hormone replenishment, as we talk about it in the interview, because it really is replenishing the hormones that a woman once had. Even thyroid hormone replenishment could be called the same. So the black box warning was just recently taken off of this, and many women are running back to their doctors asking for the hormone replenishment. Some are still afraid. And the message that I want to bring home today is that there is a lot of prevention that can be done with hormone replenishment. Not just the symptom relief of joint pain and palpitations and insomnia and hot flushes and night sweats. Not just that. Hormone replacement helps make the cardiovascular system stronger. And when started, right at the time of menopause, when a woman's period stops, this will help potentially alleviate 50% of heart attacks and strokes. That's pretty strong. That's a lot of good information to have. So if you have a family history of cardiovascular disease, this is something I would encourage you to jump on the bandwagon with. Dementia. When started at the time of menopause, dementia can be abated. It can be prolonged, even if there's a strong family history of it. Osteoporosis, a reduction in hip fractures and painful spine fractures, that can also be very much helped. And the muscle wasting. So when we think about the reasons that people go into nursing homes, and I know that everybody has their own vision, remembrance of a nursing home. When I was young, growing up in a small town in Texas, we went Christmas caroling into nursing homes at Christmas time with the church youth group. And this was the first time I'd ever been into a nursing home. People don't like to go there. They're not fun. People don't like to visit. They visit out of obligation. If you want to stay out of a nursing home, this is what you need to avoid. You need to avoid having a stroke. You need to avoid dementia. You need to avoid hip fractures, and you need to keep your muscles strong. So muscle strength keeps us out of walkers. It keeps our urinary tract strong. It keeps us out of diapers. It keeps us from having urinary tract infections and ending up with sepsis and in the ICU. Preventing osteoporosis prevents hip fractures. Just like I said, dementia, cardiovascular disease prevention, all preventable. I will add, there are definitely lifestyle factors that can also help tremendously with these. Hormones are not the answer to everything, as we'll hear from Carlos Reynes next week. It's worth thinking about. It's worth considering. It's worth discussing with your family and your friends. If you have any questions, reach out to me, BethClaxtonMD.com. Schedule a free 15-minute call, and we can have a conversation. You can tell I'm quite passionate about this. I really do think that hormones are part of the upstream medicine that we are offering today in functional medicine and in lifestyle medicine. And I'd love to hear any questions, concerns, anything that you have around hormone replacement. It's a conversation that I never grow tired of having. So until next time, I want you to know that you can always find back episodes of Rooted in Healing on KAZM, 106.5 FM, 780 AM, mellowmountainradio.com. We are on Saturday mornings at 9 a.m. I can be found at bethclaxtonmd.com. And please, until next time, find what makes you happy. Find what makes you feel joyful and vibrant, because that truly is the root of health.